This image may seem normal at first, a crying baby in a hospital, but if you look closely, this is anything but normal. The babies were born addicted to drugs. In just the last 15 years, nationwide numbers have quadrupled, and in Florida, they are higher than they've ever been. 10 Investigates' Jennifer Titus taking a look at what is being done to stop this growing epidemic.
By looking at Enzo, you may be surprised to hear that he is just 4 years old.
Let's climb up the rock wall.
He's tall, handsome, full of energy. A beautiful gift for his parents, Deanna and Bill DeChico.
Very nice.
It's been our greatest adventure.
But life didn't start out easy. The couple adopted Enzo when he was just a few days old, sight unseen. When they would get to the hospital to meet him, they would see something that no parent would ever imagine their newborn child would have to go through.
They're screaming the most inconsolable scream. It's an excruciating pain for them.
Enzo was detoxing from drugs.
Pulse, shake, vomit, diarrhea, seizing.
Enzo is one of the thousands of babies born every year addicted to drugs. In Florida alone, the numbers have continued to rise. Some say it's better reporting. Most officials call it a growing epidemic. You see, 10 years ago, the number of babies born addicted to drugs in the state for 1 year was enough to fill an entire elementary school, the number 536. In 2015, that number could fill an entire high school, almost 2,500 babies in 1 year. Last year, that number could fill 2 high schools. And when you look county by county for 2016, the county with the most babies born addicted, Hillsborough. We took the numbers to the medical director of the newborn intensive care unit at St. Joe's Hospital in Tampa.
Our one institution numbers may have gone down. This is still a major U.S. public health problem.
So what's being done? In 2013, Attorney General Pam Bondi created a task force on prescription drug abuse and newborns. And in its final report made recommendations on how to get the numbers down by increasing early prevention programs and educating healthcare providers. 10 Investigates also contacted the Department of Children and Families after finding an article back in 2008 that showed they opened up the state's first drug-dependent newborn unit in Orlando. In an email with DCF, they state the unit is no longer active, and cases involving substance-exposed newborns are handled by Child Protective Investigators.
This is a critical step.
To find out what more is being done, we took questions to Governor Scott at a press conference where he announced a $50 million proposal to fight the opioid epidemic.
Every time that you see a problem and it hasn't been resolved, you like to try to. You always. I'm a business guy, and you say in my business life, if it's not working, you say what do I do differently and try to change, and that's what we're doing with this.
You're just not saying that maybe more needs to be done. Like, what is your answer to that?
I mean, everything. I know everyone's trying to come up with solutions. The best solution is stop the addiction.
It's very upsetting because it makes me realize how many of these children are not having any of the opportunities that Enzo has, and how many of them are victims of circumstance. And there's nothing being done about it. There's not really any repercussion for anyone, the mothers, and there's no places for these children to go.
For Deanna DeChico, she says she doesn't have the answers, and unfortunately, either do officials when it comes to not only the growing numbers, but what the long-term effects are when a baby is born addicted.
Are you having good listening skills? I'm so proud of you.
Because while Enzo may be taller than most 4-year-olds and a ball full of energy, he is on a journey that is left with unknowns.
Come on, let's come down the slide one more time. Honestly, I have more people tell me that know me. If I didn't know you and I didn't know Enzo, I wouldn't even know about NAS or what it meant or that existed. Here we go. Ready? And I truly believe sometimes that's our journey.
Good job. High five.
That's it.
High five. More money. Ready, too?
And again, the thing about the numbers growing is that there are no long-term studies even being done on the effects babies born addicted to drugs will have in 10, 15 to 20 years down the road. But now I want to show you this right here. This is part of a 100-page lawsuit filed by district attorneys in Tennessee against opioid manufacturers, and it was filed on behalf of local babies born addicted. Jennifer Titus, 10 Investigates.